this is Dr. Mustansir Electricwala, a general and cosmetic dentist. We are going to discuss a few dental tips and tricks which will help you treat your teeth better and thus making a visit to the dentist problem free. Take care of your teeth. Achieving healthy teeth takes a lifetime of care. Even if you've been told that you have nice teeth, it's crucial to take the right steps every day to take care of them and prevent problems. This involves getting the right oral care products as well as being mindful of your daily habits. Brushing. Don't go to bed without brushing your teeth. It's no secret that the general recommendation is to brush at least for 2 to 3 minutes twice a day. Still, many of us continue to neglect brushing at night. But brushing before bed gets rid of the germs and plaque that accumulate throughout the day. Brush properly. The way you brush is equally important. In fact, doing a poor job of brushing your teeth is almost as bad as not brushing at all. Take your time, moving the toothbrush in gentle front and back as well as elliptical motions. Make sure to slightly tilt your brush head towards the gums to remove the plaque from the junction of the tooth and the gums. Also, make sure that you go on the back side of the teeth, of your lower teeth and the back side of your last teeth. You also have these single tufted brushes which you can use for the last wisdom tooth where it is difficult to reach with the normal size toothbrush. Brush types. Always use a soft or medium bristle brush, never a hard one. This can lead to damaging not only your tooth structure by abrasive action, but can also lead to gum recession, bleeding gums, and sensitive teeth. One of the most common queries is whether to shift to electric toothbrush over a manual one. It has been found that both are highly effective, but when used correctly. For people who have medical conditions which make brushing difficult to do, and elderly people who have difficulty in holding a brush and applying the appropriate pressure, the electric toothbrush is proven to be the recommended option. With the advancements in technology nowadays, not only do you have Bluetooth supported apps which give you a live feedback on where you are spending the time while brushing, amount of pressure being applied in different sections, areas you have missed, and the total amount of time spent. This not only improves your brushing habits, but is a regular reminder for what you're doing wrong. Toothpaste. The most common question asked to me is, which toothpaste do I recommend? Well, the answer is none or all. Well, to explain this better, let's say you have bleeding issues from your gums. If you have been using a sensitive toothpaste, which I recommended, then that would be of no benefit to resolve your issue. In the same way, taking another example, say you have sensitive teeth and you have been using a whitening toothpaste. This not only didn't resolve your problem, but in fact it made it worse, as many whitening agents can lead to increased sensitivity due to some of the ingredients which help achieve the whitening effect. Hence, what I usually tell my patients is, tell me your present problem and I will tell you what's best for you for now. And yes, that does not mean the same toothpaste needs to be used by the rest of the family members. What I would recommend though is no matter what type of toothpaste you choose, whether with strawberry flavor or cool mint, make sure it contains fluoride. This is because fluoride is a leading defense against tooth decay. It works by fighting germs that can lead to cavities, as well as providing a protective barrier for your teeth. And yes, the quantity matters. Unlike the advertisements you see where they completely cover the brush head with a good amount of well-placed toothpaste, just a pea-sized toothpaste will do the job. Yes, that's correct. Pea size is more than enough for brushing once. And for kids who are very small, just a smear layer is enough. Also make sure that you buy the age recommended toothpaste for your kids. The ages are usually mentioned on the top of the toothpaste as they have different amount of fluoride which is different for different age groups. Please don't give them the adult toothpaste thinking it's the same. Don't neglect your tongue. Plaque can also build up on your tongue. Not only can this lead to bad mouth odor, but it can also lead to other oral health problems. Gently brush your tongue every time you brush your teeth. Interdental brushing. One of the studies have found that brushing is able to remove only 60% of the dirt from your teeth. 40% is left behind in between the teeth. Hence, the use of interdental cleaning devices is essential in our day-to-day routine, according to me. Treat flossing as important as brushing. So, while using the dental floss, make sure that you take a long strand initially when you are new to it, approximately 6 inches. Then you need to twist it 2 to 3 times in your middle finger so you get a good grip basically. All right. So the shorter the knot is, the more firm you get to do it and hold it. Now, say example you're using this area where you need to floss it interdentally. So you're gonna use your index finger and your thumb, and you're gonna go right in the middle and make sure that you just don't go straight down because that's when you're gonna hurt your gums. So always follow the contour of the tooth and go down, then come up and then again go back down following the contour of the adjacent tooth. In this fashion, you are able to get all the food out from between. Now, in case the floss gets stuck in the middle and it's not been able to come out, you don't need to pull it up. You can just leave one of your fingers from one side and you can just slide it out the other side. And in this way, the food still comes out. Flossing is not just for getting those little pieces of Chinese food, meat, or broccoli that may have got stuck in between your teeth. It's really a way to stimulate the gums, reduce plaque, and help lower inflammation in the area. Flossing once a day is usually enough to reap these benefits. Don't let flossing difficulties stop you. Flossing can be difficult, especially for young children and older adults with arthritis. Rather than give up, look for tools that can help you floss your teeth. Ready to use dental flossers from the drugstore can make a difference. Even products such as water floss sets are beneficial for the older adults who have done multiple dental treatments over the years and have implants, crowns, and bridges placed in the mouth. Mouthwashes. Mouthwash helps in three ways. It reduces the amount of acid in the mouth, cleans hard to brush areas in and around the gums, and remineralizes the teeth. Mouthwashes are useful as an adjunct tool to help bring things into balance. I think in children and older people, where the ability to brush and floss may not be ideal, a mouthwash is particularly helpful. Ask your dentist for specific mouthwash recommendations. Drink more water. Water continues to be the best beverage for your overall health, including oral health. Also, as a rule of thumb, drink water after every meal. This can help wash out some of the negative effects of sticky and acidic foods and beverages in between brushing. Eat crunchy fruits and vegetables. Ready to eat foods are convenient, but perhaps not so much when it comes to your teeth. Eating fresh, crunchy produce not only contains more healthy fiber, but it's also the best choice for your teeth. So try to avoid the overly mushy processed stuff. Stop cutting things into tiny pieces and get those jaws working. Limit sugary and acidic foods. Ultimately, sugar converts into acid in the mouth, which can then erode the enamel of your teeth. These acids are what lead to cavities. Acidic fruits, teas, and coffees can also wear down tooth enamel. While you don't necessarily have to avoid such food altogether, it doesn't hurt to be mindful. See your dentist at least twice a year. Your own everyday habits are crucial to your overall oral health. Still, even the most dutiful brushers and flossers need to see a dentist regularly. At minimum, you should see your dentist for cleaning and checkups twice a year. Not only can a dentist remove calculus and look for cavities, but they will also be able to spot potential issues and offer treatment solutions. Keeping the most important tip for the last, the way to floss, brush, and use mouthwash together. Every morning when you wake up, first thing is to rinse your mouth with water, followed by brushing your teeth. This is followed up by your breakfast. Just when you're about to leave for work, use a mouthwash. Take 10 ml of mouthwash in a cup and rinse with it for 30 seconds and then spit it out. Please do not use water to rinse out the remaining liquid. You can spit if the flavor is too strong. Take a little bit of water if required to take it off your tongue. But that's it. We have a tendency to rinse with water thoroughly post our brushing and using a mouthwash. But this removes the essential layer formed over the teeth and gums. Once this is done, leave for work and no eating or drinking for the next 30 to 45 minutes, which will help keep this layer help do its function for your oral health. The same rule is to be applied at night. Post your dinner, floss your teeth first, then brush, after which do your other necessary house chores, and just when you're about to go to sleep, rinse with the mouthwash. Not only will this help act as a barrier for protection, but also reduce the bad odor from your mouth over the night. Hope you enjoyed the talk. And if you learned even one essential point from this, which you would start applying immediately, that would make me happier. Until our next talk, this is Dr. Mustansir signing off.